Hello everyone, this is Shalu Kumar again from ONTC. I'm an experienced OSCE nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE nurse training Cambridge. I hope you're all enjoying this warm weather, and other thing is thank you very much for sending all those lovely messages, comments through the website or our WhatsApp messages. I really appreciate all your feedback, and I hope these videos are really helping you to pass your exam, hopefully first time. Okay, so I'm going to be doing another video today. So if you do like my videos, please subscribe to our channel and also press the like button. So in today's video, I'm going to be talking about one of your other NMC stations, OSCE station, which is the evidence-based practice station. So in this station, your assessor is looking how you're going to apply the knowledge of current evidence-based practice and research to your own nursing practice. Okay, so it's not a complicated subject. It's basically knowing as a nurse that the care you deliver to your patient or health education you give to your patient is evidence-based, and that means it will be effective. Okay, so that's the only thing. So there are set topics that you need to read about in this station. So I'm going to be telling in this video, what paperwork you will have in the test center for this, how to prepare for this station, how to write your answers, a worked out scenario, and also, like always, my top tips at the end of the video. Okay, so let's talk about evidence-based practice station. So it's a written station and it's 10 minutes. Okay, and you will be given a scenario to read, and also you will be given a short research article or a study, okay, to read, and it will not be very long, probably a page long to read. And then you will have to write your health education points to this patient scenario. You've been given a patient in the scenario, so you will write the health education points to your patient, reflecting that you have read the evidence and you have applied that to your answers. Okay, so that's what you need to do. Right, okay, so how do we prepare for this station? Right, for this station, I would say there are 5 set topics, and you should read widely around those topics and see what is the current practice, what is the evidence based, okay, behind those topics. Then you should also complete some practice scenarios, and also, like always, I always remind you that make sure you have read the marking criteria set by the test centers. Okay, it's really important because they give you guidance what kind of answers your your assessor is looking for, what kind of points they are looking for you to cover in your bullet points, okay, in your answer. So it's really important that you go through the marking criteria. I'm going to attach a copy of the marking criteria to the description of this video below. Okay, so now let's talk about what 5 topics which are on your screen now. So what 5 topics can come in your exam under this station? So the first one is diabetes, second one is female myocardial infarction, third one is smoking cessation, fourth one is prevention of pressure ulcers using foam dressing, and the fifth one is honey dressing for venous leg ulcer treatment. So these are the 5 areas the NMC has chosen, and your station on that day, your scenario will be based on one of these 5 areas, not all 5, just one of these 5 areas, but we don't know which one, so we're going to have to prepare for all of them. Right, so next screen I'm going to show you a little scenario, and then we're going to work out the answer, and the topic I have chosen is diabetes. Okay, so I'm going to show you a scenario on the screen. So let's read that together. So you're running a diabetic clinic as a practice nurse in GP surgery. Mrs. Peters. Now, the name I have used is not for a real person. This is purely just for explaining my scenario, and I repeat it again, this does not belong to a real person. Okay, so it's just for scenario purpose, just to explain the station to you. Okay, so Mrs. Peter Mrs. Peter has a new diagnosis of type 2 diabetes mellitus, and has an appointment to see you about health education and lifestyle advice to manage her diabetes. So she takes metformin 500 milligram BD and no insulin at the moment. So read the article provided and make reference to it throughout the station, and answer, write your answer in bullet points. Okay, so that's what examiner has asked you to do. So in the next slide now, I'm going to show you a little study I have taken from NHS UK website. NHS UK website is very good website to go and look at different topics, and also the other website I will recommend that you have a look is the NICE, which is National Institute of Care Excellence. So that's another very good, reliable resource for you to do your research and look into your evidence-based practice. Okay, so this article is from NHS UK website. So you can see it tells you quite a lot of information, what is the current evidence behind a hypoglycemic attack. So it talks about hypoglycemia and what are the reasons for hypoglycemia, why does it happen, what are the signs and symptoms patients should watch out for, and what should they do if they suspect they are having a hypoglycemic attack. So it talks about quite a lot. So in the next screen, my first job will be to just quickly see, underline or see what main points there are in the study, so which I will be then able to change into full sentence bullet points to write in my answer. So I quickly look at it. So like I said, the first thing I just need to know is it likely, how likely it is for hypoglycemic attack to happen. So I will talk about that in Mrs. Peters' case. Okay, and then how does she recognize any symptoms? What are the symptoms of hypoglycemic attack, and what should she do if she suspects she is having a hypoglycemic episode, and also what information she gives to her family and friends, so they are able to help her if she's having a hypoglycemic episode. And also, if she has an episode of acute illness, how can that affect blood sugar level. So these are the main things I know in the study which they are there. So these are the ones I will decide now to write in bullet points. So let's look at how we're going to write that answer. So on your next slide, I have write the answer. So I will inform Mrs. Peters because she is not taking insulin, therefore she's less likely to have a hypoglycemic experience. But as per evidence from the recent study, there is still a possibility. So we will say I will inform Mrs. Peters that because of she's not on insulin, therefore less likely to experience hypoglycemia as per evidence from the recent research study, but it can still happen even with taking metformin. Therefore, she should check her blood sugar regularly and also should be able to recognize the signs and symptoms of a hypoglycemic episode or attack. Okay. Number 2 will be I will inform Mrs. Peter that as per current evidence, the hypoglycemic attacks are normally caused by missing a meal or not eating enough carbohydrates in your meal, or taking too much of your medication or insulin. Okay. Third thing I will say is I will advise Mrs. Peter to observe for excessive sweating. So I'm going to talk about the signs and symptoms in my third point. So I will say I will advise Mrs. Peter to observe the excessive sweating, feeling faint, lightheaded, blurred vision, new confusion, or nausea. So these are the signs and symptoms which will indicate that she may be having a hypoglycemic episode. Okay. Number 4, I will advise Mrs. Peter to inform friends and family to look for these signs of hypoglycemia. So if she appears confused or loses consciousness, she may be having a hypoglycemic episode and will need emergency medical help by calling 999. Okay, so number 5 I will inform that an episode of acute illness can affect blood sugar levels and it can cause irregularities in blood sugar. So she will need to monitor her blood sugars more frequently and report any changes to her GP, or if they are severe enough, these changes, then ring 999 straight away if needed. So that's how I will write it. So that's what you need to do. So read widely on those topics, and then when you given a study, just make sure you know the main points and then turn them into your bullet points and write a very clear answer. Okay, so now my 5 top tips. First one is neatness of your writing. Okay, so make sure you write legibly, neatly, so your assessor can mark it straight away. Number two, time management. Okay, so you make sure that you can read the scenario and read the study and still answer all your bullet points within 10 minutes. So practice a lot. Okay, so practice writing these stations. Tip number three is practice all different scenarios. Okay, all different topics. Read widely about it and practice all those scenarios and topics. Okay, tip number four is obviously the marking criteria. So make sure that you have read the marking criteria and you understand, the marking criteria and how it will reflect in your answers as well. And tip number five is, again, you're all wonderful nurses, I always say that. So if you just feel a bit stuck at a time, just read the study again, and I'm sure the main points will come to your mind very quickly once you're reading that evidence-based article. Okay, so those are my 5 top tips. I hope you enjoyed the video, and please press the like button now and subscribe to my channel, and also visit us on oscinustraining.com, and I will soon be back with another video. So bye for now.